All right, everybody, welcome back for another deep dive. Today we're looking into Crozer Health
Yes.
in Delaware County, Pennsylvania. You guys sent in some articles about the sale of Crozer Chester and Taylor hospitals.
Right.
And just as we were getting ready to really dig into this, some major news broke.
Big news today.
So what is going on?
Well, as of this morning, Prospect Medical Holdings,
Okay.
the parent company of Crozer,
Mm-hmm.
announced that they are selling their Delaware County hospitals.
Wow.
And this comes just 3 weeks after they filed for Chapter 11 bankruptcy.
This is like watching a slow-motion train wreck.
It is.
Didn't the sales motion even mention that, like, hospitals might close
Yes,
if they didn't find a buyer?
absolutely. And
Yeah.
patients could be turned away.
So what does the sale actually mean then for patients?
So that's the good news.
Okay.
The sale aims to keep these hospitals running.
Okay.
But it's complicated. We know that the state of Pennsylvania is involved, but we don't know the specifics yet. CBS is trying to get further comment from the state.
So it's kind of like a little bit of hope, but
Yeah.
a lot of questions still.
A lot of unanswered questions, yeah.
Something else that struck me was, wasn't Prospect Medical Holdings, like, under fire just last October?
They were.
Didn't the Pennsylvania Attorney General accuse them of some, like, shady financial dealings?
Yes. So the Attorney General's office accused Prospect of diverting over $450 million
Wow.
to private investors instead of reinvesting that money back into the healthcare system.
Hold on. So they're selling these hospitals after being accused of basically bleeding them dry for profit.
Right.
What's the buyer's angle in all of this?
So that's what's interesting. The buyer is a not-for-profit consortium. So this is a shift from a for-profit to a not-for-profit model.
Huge.
Yeah, this is big.
Help me understand, like, what are the implications of that?
Sure.
What are the potential, pros and cons, especially for patients and staff?
So let's look at the positives first.
Okay.
A not-for-profit model should prioritize patient care
Right.
and community needs over shareholder profits.
Okay.
So we might see better staffing ratios, facility upgrades,
That'd be great.
a wider range of services offered.
That makes sense.
But not-for-profits
Yeah.
usually operate on thinner margins.
Okay.
So attracting and retaining top medical professionals or investing in the latest medical technologies might be more difficult.
So it's like a trade-off.
Yeah.
Could this sale actually lead to better health care for the people who rely on these hospitals?
That's the question, isn't it?
Yeah. Or is it just like rearranging deck chairs on the Titanic?
Well, one thing to remember is that the Attorney General's accusations may have actually pushed Prospect to sell.
Oh, like to get out.
It could be their way of addressing the allegations
Interesting.
and maybe mitigating further legal problems.
They're trying to wash their hands of the whole thing.
Possibly.
What about the new owners? What kind of hurdles are they facing stepping into this?
Well, they're definitely inheriting a very complex situation. Rebuilding community trust after this whole controversy is going to be a big job for them.
Yeah, for sure.
They'll also need to figure out how to handle any potential financial shortfalls
Oh, okay.
and make sure there's a smooth transition.
Right.
But this is a huge undertaking. It also presents an opportunity
Right.
for a fresh start, a chance to really reshape healthcare.
In Delaware County.
Yeah.
Okay, so we have a sale prompted by bankruptcy
Right.
and these looming accusations of financial mismanagement, plus a move from for-profit to not-for-profit healthcare, which raises all sorts of questions.
Yeah.
What are some of the bigger picture implications here?
Well, this sale could be a sign of things to come
Okay.
for other struggling for-profit hospitals.
Nationwide.
Nationwide, exactly. We also have to think about the ripple effects on healthcare costs and accessibility in the region.
Right.
This has implications way beyond Delaware County.
So much at stake.
A lot.
Well, we've covered a lot of ground today, guys.
We have.
A major hospital sale bankruptcy, allegations of financial wrongdoing, and the uncertainty of this transition from for-profit to not-for-profit. This is a story that's just getting started.
Absolutely. And it leads to a question for you, our listeners.
Okay.
How do you think this sale might change healthcare? Not just in Delaware County, but beyond.
That's something to think about. What does this sale mean for the future of healthcare in your community? Stay informed and let us know what you think.
Yes, your voice matters.
All right. Thanks for joining us for another deep dive. We'll see you next time.
See you later.